Not getting your health and well Not getting your health and wellness questions answered at your doctor's office? Are you ready to take control of your health and well-being? Do you want the proper tools to set you on your wellness journey? Do you want to meet and chat with expert members of the healthcare team? Well, step into Real Time with Dr. Stacy. Hi, I'm Dr. Stacy de Gale, your personal physiotherapist and wellness consultant who wants to make sure that you live your best life. We'll be chatting with wellness team members and inviting you as you are the center of that team. And we'll be doing all of this while you are in the comfort of your own home or office. Join me in Real Time with Dr. Stacy as we discuss everything health and everything wellness. Hi everybody, it's been such a long time and thank you for joining me, Dr. Stacy de Gale, hopefully one of your favorite physiotherapists, back with Real Time with Dr. Stacy. We've been absent for a while, but we've been very busy, and if you've been following my pages, you know why. We've been doing so much work for Pink October, for arthritis, for diabetes awareness. We've been quite busy. So thank you for spending some time with me this evening because we have some very important information to learn and share with each other. And as usual, I have to say that I'm always so privileged to have the opportunity to speak with guests right here, born in Trinidad and Tobago, living here, working here, who are experts in their fields. And so I am so excited to welcome one of our guests very soon. So there are a few of you online already. Please share this live. Share it on your Facebook pages. Share it wherever. Let people know that we're on. Because we're speaking about a very important topic. We're looking at digital healthcare, virtual health. What does it mean? What does it mean for you? How can you access healthcare in the comfort of your own home, safely and affordably? And yes, we have those services available right here in Trinidad and Tobago. So share this information. Don't keep it to yourself. And remember to like us on Facebook, on Instagram, on YouTube, Real Time with Dr. Stacy, as well as Back in Motion TT. So I'm not going to spend too much time speaking anymore. I can't wait to introduce this next guest. Now, I have known this doctor for quite a number of years. And ever since I've known him, he has always been very active in improving the health care of the community. It's not just about going into the office and coming out. It's about giving back. And I'm so very happy that he said yes to be a guest on our show. And his name is Dr. Navi Muradali. So some of you, that name may be very familiar. So I'm putting him up so you can see the handsome face. You know, I only have handsome and pretty people on this show. And that name is familiar because, let me tell you, he is not only a medical doctor. Listen, let me get my paper. He was also a past mayor of San Fernando when it was in its heyday. So a lot of that we have to thank him for. He was chairman of public health, and he was the city medical officer at the San Fernando Corp. I am also saying to you that Dr. Muradali is a holder of numerous degrees, not only in medicine, but in dentistry and in econ. So we have somebody who has a wide cadre of information, and there's no other one better poised to share with us information about accessing healthcare right from your home, because he was also the founder of a very innovative initiative called Virtual Wellness, which has now morphed into something called Patients Connect. And we are going to get into that very soon. But let me say a very special welcome to Dr. Muradali. Dr. Muradali, welcome to Real Time.
Yes, Dr. de Gale. Thank you very much for that introduction.
Oh,
And
it's
I
a
see,
pleasure to have you.
yeah, I see that you're continuing to do a lot of great work in, in promoting your discipline and promoting healthcare. And I must commend you. I must commend, your fans, your Facebook
Oh,
following, your social media following, really, for joining, these discussions, because I'm
yes,
sure at the end
yes,
of the day, what you and I would like to accomplish would be that someone leaves here with some more information that they did not have, so that it
correct,
can assist them in in their healthcare. And I think that's the
correct,
most important take home for all of us when we're in this profession.
correct. And especially in this time where the economy is showing for everybody, it's a stressful economy. It's in some cases it's on the decline, and everybody is looking to see where they can save their pockets but still get quality healthcare, quality food, quality entertainment. So we are focused on the healthcare aspect of things today. And to all the viewers out there, please remember, if you have any questions, Doc is here to answer them once he can. If we cannot, we will get the information for you and get back to you. So feel free to post your comments on the feed. I will be able to see them and share them. Special good night to Glynis. Glynis Butler is a nursing assistant who is in the US right now for a little bit, and she's joining us. So this is not only for the Caribbean. This information is important for the entire America region, the Americas. So North America, South America, which includes Latin America, and of course the Caribbean. So, Doc, I mentioned the virtual wellness, and tell us a little bit about that journey. What virtual wellness was about, how that came into being, why? Tell us about that baby that you birthed.
Yes. Well, you were part of it, so I'm sure you will be able to, to fill in any gaps. But virtual wellness was really born during the pandemic. And what I found in my practice, in my medical practice, was the fact that we could not interact with our patients again, physically. And I have a lot of diabetic patients, patients with high blood pressure. So I needed to get access to these patients to monitor their condition. And I felt that WhatsApp, yes, WhatsApp, we all use WhatsApp, but it's not really the type of portal that you want to be able to interact with your patient. It's not friendly for the healthcare needs. So what I decided to do was to look around and see if there was any sort of telehealth, telemedicine portal where I could have video calls with my patients. And I could not find anything locally. And internationally, there are lots of brands out there like Teladoc, even Zoom had their health platform, but the cost, there was a huge cost to it. So when you factor in the cost that we would have to pay, the patient would have to pay in US dollars, it really did not make sense for us to go that route. So what we decided to do, I decided, let me try and learn some new skills in this pandemic. Instead of, just going to the office and trying to keep in touch with patients via WhatsApp, let me see if I could get a platform, some sort of technology where I could do video calls in a safe, secure manner. And it must be where I could protect the patient's data and their privacy. So which is why, as again, I said WhatsApp was probably not the forum for it. Yes, many of us still used it, but it was not the ideal platform. So I tried to do some research. I did my own studies. I tried to learn some skills. I ended up learning some basic IT skills and some basic graphic skills, which has really helped me today. And what we created was virtual wellness. And virtual wellness became a free telehealth platform um, for the last 2 years. We worked with all of the associations. So I did reach out to you and
Yes.
your colleagues in physiotherapy. We reached out to many of the doctors who I would have been, my colleagues. We also reached out to the associations like Titandi, the dietitians and the nutritionists. We reached out to Diabetes Association, TAP for the seniors, Supermarket Association, anyone that we believe that will be able to share it with their membership and their followers and their following, we shared it with, and it became something huge. We saw over 9,000 persons,
Wow.
right, in the past 2 years on virtual wellness, and all of these consultations were done at no charge. No one paid anything. They did video calls, we sent
Yes.
emails, text messages, whatever it took on that platform.
Yes.
We used it because it was available to us, and we definitely we thought that it really helped. I know you did some free clinics. We did some free
Yes.
clinics as well, and
Correct.
you would have gotten certain clients, certain patients
Yes.
coming in and asking you certain questions. So we ran quite a few free clinics with the help of other organizations, and I must really single out, like the Supermarket Association for helping
Mhm.
us. Say what, TT.
Yes.
They share the links with their following, and they have huge followings on social media. And of course, all the associations, all of the NGOs. I must also say, Dr. Margaret at the Association for Psychologists, or they were
Right.
very, very helpful because they had a free service for mental health. So we partnered, and we were just blown away by the amount of persons during the pandemic, with anxiety, they're feeling sad, they're feeling some sort of emotions. And it was so good that, we could have offered that service together with the Association of Psychologists. I thought it was a really great program. And, that is really where virtual wellness, was born. And
Yes.
as you said, we had to morph. We had to morph. We could not
Yes.
continue a free platform, a free healthcare platform.
Correct.
It's very taxing
We
for
need something
all of the
sustainable.
providers. So yeah,
Correct.
so we have now made it sustainable, and I know that we will get into that
Into
later
that.
on in the discussion. Yes.
So it's so interesting that in these 2 years, COVID really bore so much. COVID was a stressful time. It still is a stressful time, but it also showed us as human beings, as parents, as siblings, as health professionals, whatever, in whatever sphere, that we can learn a lot during that time. And we had two options, actually three options: to stay still during COVID, to grow, or to regress. And through this virtual platform, virtual wellness, you showed some progression, because I'm unaware of any other platform that existed in Trinidad prior to that. Was there any platform similar to that one before in
Not
Trinidad?
that not that
I
I'm
can't
aware of.
recall.
There were some paid services. There were some probably
Yeah,
paid telehealth services, but nothing to that effect. Nothing to that
effect.
scale that we had.
But what is important as well to note is that in 2 years, with only a handful of healthcare practitioners working assiduously, there were over 9,000 visits, which shows that people came back, which shows that people spread the word, and that there was such a great impact. So I want, if you can share with our viewers, because I know there's a bit of hesitancy when we talk about digital care. How can I get care from somebody online? How can they help me? They can't touch me. I'll give you a joke. I remember a few years ago, my mother, she was an excellent nurse, retired a few years now, but old school. So her doctor, Dr. Saini, God rest his soul, many, many years ago, anybody who came to Dr. Saini's office, he would auscultate the chest. And I remember mommy going to a doctor about 5 years ago for pain in her knee. And she was so annoyed when she left, saying, he didn't listen to my chest. I said, you're getting chest pain? No, you're not getting chest pain, mommy. He didn't have to touch your chest, but it's that, old school sort of thinking. So share with our viewers the value of virtual health, and to help them allay their fears on using virtual platforms.
Yeah, let me just add to that, Stacy, that it's not only just patients coming in for any complaint believe that they have to have their chest listened to with a stethoscope. It's also that they must have an injection and they must get some Panadol. I mean, that's the reality. But whether it's needed or not, or that's debatable. But the yes, we because of the pandemic and places were closed, people really had no choice in terms of, where they when they needed some medical care, they would definitely, if they saw the link, they would utilize it. Of course, very apprehensive. They were trying to figure out, what this whole platform is about. And what we found is that once they were able to have that face to face with the health provider, and let me just say that, virtual wellness was not just about getting care from doctors or specialists. It was about physiotherapists, um, dietitians, people looking to have some sort of um, plan in place for weight loss, or what have you. It was about, as I mentioned, the importance of mental health. So there were lots of counseling sessions there. We had nurses. So we had a lot of healthcare providers, pharmacists as well. So when persons actually broke that barrier and had that consultation, they were able to see the benefit really of digital healthcare. And we also kind of narrow it sometimes. We believe that digital healthcare is just telehealth, which is just, a face-to-face video. And, as we would go into it in a short while, that's not the case. There are so many other facets of digital healthcare that can assist the patient in their space. And that's the key thing, in their space, whether that space is a home, whether that space is a workplace, that space may be, um, an assisted home, maybe a home for the elderly. It may even be a hospital or a clinic. Whichever space you are in, that is, once you have a phone and internet, or a laptop, a desktop, a tablet, and internet, you can access care. And that is really the importance of why we need to promote digital healthcare, not as a replacement for in-person care. Digital healthcare is not a replacement, but it certainly supports the care that you're receiving from whatever health provider that you have. And it opens up new possibilities to
Yes.
better care, and better care because you now have remote home monitoring. So we have a device, and we are now starting to do some testing in the local market, where you can listen to your heart at home, and
Wow.
and send those sounds either live or recorded to your doctor. You could
Right.
watch your ear. Your ENT doctor could watch you remotely, watching inside your ear or your nose or your throat.
Wow.
They can look into your eye remotely. There are so many possibilities. You can check your glucose, your blood
Yes.
pressure, your pulse rate, your heart, your oxygen saturation. All of those things you could be doing in your space, at your home, or in your work, and
Yes.
those can be sent directly to your physician, or if you have a team of physicians, in real time, and an intervention
Yes.
can be made. So you cannot do that just with in-person care, because it means that
Correct.
you would either have to live um, in your doctor's office,
In the
or
doctor's
you would have to,
office.
or you would have to be in a hospital setting to have that sort of
Yes.
monitoring. So now you could have hospital
Wow.
type monitoring while you are at
Yes.
home or in your workplace, and that
If you're
that's so that
looking
is,
for if you're
yes,
looking for a little prototype to help, I don't mind being one of those patients
absolutely.
utilized.
Consider that done, Stacy. Consider that done.
No, but it is amazing. The as you said, it opens up so many possibilities, and it is not a means to replace. It is an adjunct. It's a complementary space, and something you pointed out that is so very important now. Now I live in Point Fortin, and for those who are listening, I have one or two viewers. Sybil, hi. Sybil is in St. Lucia, a fellow physiotherapist. Thanks for tuning in. We have people who are not from Trinidad. I live in deep south in Trinidad. And sometimes if I have to go to Port of Spain, for example, to see my eye specialist, I would leave Point Fortin at 5:30 in the morning. There are people who leave Point Fortin at 4:30 in the morning to get to work so that they can avoid the traffic. And we're looking at especially mothers. I'm biased, I'm female, men as well, who leave home so very early to get to work. They come back home very late. They have no time to keep doctor's appointments. So it is really a good tool because it can be utilized after hours, on weekends, in the privacy of their own homes. And sometimes so very important, as you mentioned, that mental health part of it that is plaguing our society. We are seeing the evidence of it in the news every day as to what mental health issues are plaguing us that we try to hide from. And this is a lovely opportunity for people to be unafraid and still get the care they require. Where I work, there's a psychologist, and they're very happy that they can see her where we are because we're in a sort of isolated place that nobody, quote unquote, is minding their business. And this is an opportunity where nobody has to mind your business because nobody knows. Nobody knows that you're seeing a doctor, that you're getting that care. So I think this is such a very, very important piece. It's very important, as you pointed it out, and the value of virtual care, of telemedicine, telehealth. And that is not only about the medical doctor, it's about the psychologist meeting your dietitian, your physiotherapist, your nurse, your financial advisors, lawyers, etc. This is a space for that. So I have to thank you again for all the work that you've done so far with regards to virtual wellness, and which has now morphed into Patient Connect. So tell us a bit about Patient Connect.
Okay, so what we realized is that having, gone through that experience with, seeing over 9,000 patients on the free service, that there were many other services that people were requesting. So as I mentioned to you, people were asking about, can we monitor our diabetes at home? Can we monitor our blood pressure at home in real time, or in a way where we don't have to write down the values? So I think we all have the experience. If you're a diabetic patient listening, or you suffer from high blood pressure, if you go to a clinic, whether it's private or public, the doctor always wants the readings to be recorded so that you write it down in a copybook or a piece of paper somewhere, and you have to take it. Now, we are in 2022, and we have now the technology where you don't have to do that anymore. You can use your blood pressure machine to record all of the findings, or your blood glucose machine, record all the findings, and you just transmit that. Once you have internet, or you even use your Bluetooth, it saves on your phone, you could send it afterwards. That technology is now available to us. And the importance of doing that is that as a physician, I need more up to date or even real time information on the healthcare of a patient. Waiting 3 months or 6 months for you to present this information to me is a very long time. And so many things could have gone wrong with your readings during that point. So, for example, you visit the doctor, you are now newly diagnosed as a diabetic. Your sugar has been over 200, and your doctor tells you, okay, buy a tester, go and get the strips, the machine, test it at home, record it, bring it back to me in a few weeks' time. Let's see what's going on. Let us assume that you do not go back for whatever reason, and but you continue to keep your records. You could have used digital health to be able to transmit that to your physician in real time. Because what if the medication wasn't working? What if the dose was too weak? What if the dose is too strong and the sugar is going too low, and you're feeling sick, so you stop the medication, and your diabetes gets worse and worse until you get to the complications of diabetes? So when you look at the whole, the tools that we now have to win the battle against diabetes, to win the battle against high blood pressure, and the complications of those things, the tools are available. And you don't have to wait for anyone to provide that, the government, or anyone. These things are available to you. And people will be surprised to know that telemedicine is at least one third less in price than an in person consultation. So don't be afraid of this technology. It sounds really interesting, but it's going to be very costly. It's actually one third less, so you're actually saving money. You spoke earlier about the times that we live in. You don't have to water down your healthcare in order to get quality treatment. The same physicians whom you have to physically see are now available on digital platforms.
Yes.
Whether it's Patient Connect or some other platform. So ask your doctor, doctor, do you have telemedicine option? Do you have that option where I could from time to time just reach out to you to get a review? This is not a
Yes.
first visit. This is not an emergency, but to just basically let's chat about something that may be bothering me. So let me jump into the screen and let me just show you a little bit about the platform.
So we're just gonna share a screen, just a little presentation Doc has for us to share more about Patient Connect. So please write your questions, get ready to ask any questions that you have while we have this brain. Let me tell you, Dr. Muradali is, he's so sweet, he's so gentle. This man has an immense brain. Tap into it today, people. I don't know when I'm going to get him to come back onto the show. So get your pens and paper ready and learn more about digital health in our environment.
Okay, so this is the platform, the Patient Connect platform, and we're always trying to update it. So this is entirely something that we built out locally, and we are very proud of those achievements because there are many times that, as I said, you see these other platforms in the US, like Clinico and Teledoc and all of these platforms. But those platforms, let me just say, those are very expensive platforms. So once you have the link for Patient Connect, it comes to your homepage and it's very simple. They ask you a very simple question. Do you need to book in person? So this is if you want to book an appointment for your doctor in clinic, or do you want to book a video appointment? Do you want to have an appointment with your doctor? And let us say, for example, after hours. So my consultations are sometimes all up until 10 o'clock in the night because that's how I schedule my telehealth sessions. Other doctors may do it on weekends, public holidays. So this is where, again, the technology helps patients get access to care. We have long weekends in Trinidad, like Easter, and it's so difficult to find any sort of doctor from Thursday to the following Tuesday. But this last Easter, we used this platform, and a lot of persons were able to access care. So these are the options you will be provided, and you simply, if you scroll down, you will see that almost all types of healthcare services are offered. You do have a listing of some of the providers on the main page. You will see a lot of psychologists, dietitians, pharmacists. So let's scroll down the page, and I'll just show you how simple it is. I always tell patients, if you can use WhatsApp or you could send an email, you can use Patient Connect. Um, and the location is online, but of course, if you're going physically to see the patient, the provider, you will be able to access their address. um, so you see a list of some of the clinics available, and there is a blog, and this blog is constantly being updated. And Stacy, I hope to get an article from you soon so we can post it up. So your clients, your patients could learn more about some aspect of physiotherapy that you would like to share. Maybe something on back pain, something on that type of pain, chronic pain. But we have actually, if I just use this opportunity, we have just launched this Women Connect, and this platform is really designed as a service which is going to be run by women for women's health needs. And this is something that, again, came out of the virtual wellness experience. Many persons were asking us if they could, um, you know, and in this country, we have to be mindful that we have a large Muslim population, and many of the Muslim clients, they would like to speak to a Muslim physician or a Muslim, maybe even a physiotherapist or so, but not necessarily a Muslim, but a female. So we decided, look, let us ask the woman, and I'm sure Stacey, you can be part of this. and the other health providers, that it's really designed for women who typically may not have had proper access to care. They may be apprehensive for what reason, even to go to a clinic or go to a private doctor because of maybe the cost. And this service is a very low cost service. So I'm just showing you that, we have launched this Women Connect platform as well. So if I just go back up to the home page, so let us assume, let's just let's you're looking for a dietitian. You think, you want to, carnival is coming up, you want to, lose some weight,
I have to fit
and
in my tribe
you
costume.
have to fit in your costume. I'm not promoting any band here, but you have to fit in your costume, and it's difficult because of your work, to be able to take time off to go in physically to a dietitian. So let's say you come on here, and you look at, you see that there is a dietitian available. In this case, it's Miss Yakub. So you click on the video consultation. Just scroll down. So you're looking for a date. It's a simple calendar. So let's say Thursday you think is a good day for you. Um, Let us assume one of those days. And what would happen is that once the provider has their times available, so let's say 4:30 might be better for you, or you maybe want it later, but let's go with the 4:30 for now. Um, if you already have an account, well, you just book the appointment, and that's it. If not, you do not have a patient user account, you will have to sign up for it, and you book the appointment. And now what they would do, the platform would now ask you to sign up. Um, all you require to sign up, and you can do this when we finish with this, or you could do this now as we're talking. Once you go to this link, and I'm not too sure, Stacey, if you could share the link, but if it, we can always share it afterwards in the comments. But you type in your phone number here. It's not the
Right,
186 you're typing in, but you're just typing in because it will recognize that you're in Trinidad. You put
right.
your email address, you set yourself a password, your first name, your last name, your date of birth, and your gender. You click on the patient's terms. This would basically tell you about your privacy, what's happening with your patient records. Because this platform is built on Amazon Web Services, it's encrypted, so everything that you do is safe and secure. Once you say yes, I've read everything, you just sign up, and you will get a notification via text message as well as an email to be able to log back in. And once you book the appointment, a virtual assistant will contact you. So somebody in Trinidad will contact you, and they would then just confirm with you that you have booked the appointment. They will reach out to the provider, make sure that that time is good with everyone. And
Right.
in terms of payment, there are many options for payment. This platform is connected to WePay. It's connected to
Ah,
Use.
excellent.
Yeah. So we always support Aldwin, another point person.
Yes,
So let's big up
everything
Point
good comes from
Fortin.
Point Fortin.
A lot of good things come from Point Fortin. So let's big up Aldwin Wayne with WePay, who's doing great work.
Fantastic.
Yeah, fantastic work. So the other payment options you have can be bank ACH, a wire transfer, or wherever you pay bills. We've made it very easy. So wherever you pay bills, you can go and pay the bill there. And as I said, usually the cost of these services are, in most cases, at least one third less. So let's just click on the provider listing. This is always being updated. So, for example, we have an educational psychologist, um, dietitian, another psychologist, dietitian. I think many people are familiar with Kezia Phillips. She's with the Diabetes Association. Um, Dr. Karine Clay. She's out of the U.S., but sometimes she's Trinidadian, but she works out of the U.S. now.
Right.
Um, yeah, so Zindi is a pharmacist, and what we also had during the pandemic many persons were asking about their medication. You know, people,
Right.
it's so interesting, Stacy. Out of the pandemic, I also learned so much about what patients ask about, especially
Yes.
when you're using digital technologies. Because there are many patients who go to the doctor's office. They end up with maybe a prescription. They go to the drugstore. They get it filled. They go home, and they have all these medications at home. Yes,
Yes.
it may be labeled what the medication name is, what how to take it, but they may have other questions. And many people, even if you go on Google, it's so difficult to really sift
Correct.
through what makes sense and what doesn't make sense. And what Mrs. Isaac has done here as a pharmacist, she actually talks one on one to
Right.
patients about their medication.
Yes.
And she has really made a significant difference in patient care. And I think that these are some of the services as we move forward. I think more and more people will appreciate that they have this at their fingertips. That you can just go on
Yes.
your phone, you can book an appointment with a pharmacist, and you can ask all of these questions instead of leaving your home, because this might be 10 o'clock in the night, this might be a long weekend,
Correct.
this might be a public holiday, you're trying to find out
Correct.
something. um don't wait. If you really need to find out these things, these services are now available to you.
And sometimes, Doc, the simple things that we think we have the answer for as a patient, and we don't. So you have this platform to ask your questions, not be afraid. Sometimes, you're a bit embarrassed because you think, I should know, but you don't want to ask the doctor, and you don't have to feel intimidated because it's online, it's virtually. There's more privacy to ask any question. And just, I always have a joke. So I don't know how many of our viewers used to look at House. Remember that
Of
series
course.
House?
Yes.
And there's a very interesting part where a woman comes in for uncontrolled asthma. And he says, are you using your inhalers? She said, yes, I got one this week and it's almost finished. So he looked at his almost finished. Show me how you use it. And she took her inhaler and so she was spraying it like perfume. Now it's funny, but the reality is our patients, and we see it every day, sometimes take so many medications. They take all together, they don't take it when they should. So this is an example, another example of how simple such a platform can help you to make better healthcare decisions and to have you stop wondering, why am I not getting better? When you're not getting better could simply be because you were not taking your medication how it was prescribed, or you were combining medications that you should not have, especially in rural areas where we have people going to 2 to 5 different doctors in 1 month and not sharing with the doctors what medications they're currently using. So it's just such an important
Yeah.
question. I want to go back to your presentation, but somebody asked a very interesting question that I want to throw out to you now, and I'm going to show it on the screen. And the question is, yes, we have the platform, but are our local doctors willing to accommodate the option? Are they willing to be providers? Have you had any pushback? Is there some hesitancy as well because of culture, because of what we are accustomed to as healthcare practitioners in becoming involved in such a platform, to be providers on a platform such as this?
Excellent question, Roshni. Yes, we have a product specialist, and this is a person who goes to visit doctors' offices. We have to broaden it to other providers, but we started with the doctors. And the doctors, you find that, yes, as with anything, the older doctors tend to be a little more um, hesitant about it. They say, well, I have a big practice already. I don't need to have this technology necessarily. But you find that the doctors who are Gen Z, millennials, they definitely love it. They think that telehealth, telemedicine, digital health technology will enhance their patient care, and that is the kind of thinking that we want. Now, that's on the provider side. On the patient side, we have to do a lot of work in terms of digital literacy. and digital health literacy. Things, programs like this, Stacey, they're so valuable because we can now educate people about the fact that we do have a platform in Trinidad and Tobago that can give you access to any healthcare provider, and it is in fact our intention to broaden the healthcare providers even out of Trinidad for situations where we may not have that local expertise. So Trinidadian patients, you may not necessarily need to jump on a plane and spend all that money and risk
Yes.
COVID and all of this to go to Jamaica, for example, or go to a Latin American country or go to the US and spend all that money when you can simply upload your reports
Yeah.
on this platform. So when we go back to the presentation, I'll just show you briefly that you can actually, once you sign up, you would have the ability to let me so these are some other healthcare providers on the platform, and we could go on and on. There are a lot of providers, and Dr. De Gale is also on the platform. And the I showed you the blog. So I would have had to sign in here to show you the electronic health records or the patient
Right.
records. But needless to say, the patient records are designed in such a way that when you sign up, when you log into your account, you will be asked all of the questions about, your current medical history, what
Right.
medications you're taking, your vaccination status, what vaccines you've taken. You ask all of these questions that your doctor would typically ask you in an office setting. But the importance of this is that, wait a minute, you now have your patient records 24/7, and
Yes.
you can upload x-rays, you can upload blood reports, you can upload all your medical history in one safe and secure platform.
Yes.
And if you now are being asked upon, if you're being referred, if you are going to a doctor for the first time, if you are traveling abroad and something were to happen to you and they need to know your medical history, you don't have to wait to call your doctor's office for them to fax up or email your
Yes.
medical reports. You now have it on your phone, and you once you can access it, you can provide this information, you can share this information with your health provider.
Yes.
And it's so important, that we really understand the importance of digital health technology. It is not to replace the in-person care that you get. It is to accentuate it. It is to facilitate better patient care, and that is, I think, that is the aim, as healthcare providers. Stacey, myself, and everyone on this platform, and other doctors who will join, other health providers that join, we realize that it's so important that we give patients the best care moving forward in the
Yes.
most affordable manner.
I know.
And this is where Patient Connect is trying to bridge that gap.
So we have a question from Miss Ramdeen. Hi, Miss Judy. Thanks for joining us. I know we have many specialists on board. I'm not sure if we have any nephrologists at this time. Can you tell us again, Doc, what specialists we have so far involved in Patient Connect?
Yeah, so we have orthopedic surgeons, psychiatrists, gynecologists, and we are currently building out the platform. In terms of a nephrologist, I do have colleagues who are nephrologists, and I probably need to reach out to them and ask them if they would join the program. So, we are building out the specialist network in Patient Connect, for this very reason, that we understand that, getting access to GP care, yes, a lot of GPs, but specialist care is a very
Yes.
different arena where specialist appointments may be weeks, months before you can actually see someone. And once local
Yes.
specialists are willing and able to come onto the platform, and you are willing to upload your results, your x-rays, your reports, it's very simple. You take your phone and you snap it. You just snap it and you upload it to the
Yes.
patient portal. And once you play around with it, once you sign up, it's free to sign up, and you get into your account, you will be able to see all of the what I'm talking about in terms of how simple the platform it is to use. Currently, we do have what we call um, it's a website, not an app.
Right.
The app is something that you have to go to the app store and download. Now, the reason that we said that we will not do the app at this point in time, we really wanted to first build awareness, where
Yes.
you can just go onto your phone and type in the address, or you go onto your laptop, type in the address, and you can log in and then log out, just like how you would do it with a Google account. The reason that we did not want the app, we know a lot of elderly people use it, and sometimes it's not easy for a person or who may not be tech savvy to download
Correct.
an app. And we have so many apps on our phone. I think it's an
Correct.
overkill sometimes. There's so many apps, we always run out of memory, run out of
Yes.
space. So I felt that it wasn't the time, but that time will come when we have the technology to create the app. We can do it in the morning if we want to, but we are not at that point, and we will only release the app when we have more testing of the devices that need the app to work with it. So the same
With
devices I
correct.
spoke to you about, where you can check your blood glucose, your blood um, pressure at home, you can listen to your heart sounds. I am most fascinated by that one. Um, so not we're in 2022, as I said. You can actually um, take this device, and we plan to do some pilot projects in assisted care homes, and they can
Right.
actually just take it and put it on their heart, and the doctor on the other side could say, okay, move it to the left, move it to the right, move it down, move it here, and that doctor is hearing those heart sounds in real time. And
Just
that
amazing.
is that is what we have. That technology, is already there. We're just testing it out to make sure that it works. These are devices that are approved by the FDA. The platform, our partner, I should tell you that we have partnered with Microsoft. We are now a Microsoft partner, and they have helped us tremendously in
Wow.
getting our platform up to a certain level to be internationally
Fantastic.
competitive. So now we are in Panama. We have registered in Miami, and we plan
Wow.
to really go into the Latin American market. I'll just give you a quick stat on the Latin American market.
Yes.
Chile, for example. So, I mean, people have heard the place called Chile. It's under Ecuador, Peru, on um, that Pacific end. And those countries have 70% uptake in digital health
Wow.
technologies. In other words, at least 70% of their population, they use telemedicine. The rest of Latin America is just 30%. But Colombia, Brazil, they have a lot of telemedicine platforms, but they don't have remote home care monitoring at the time. And this is
Right.
the market that we are trying to go into now. Even in the US, you would think, the US is so sophisticated, so advanced. The uptake of telemedicine there is just about maybe 50, 60% of their
Yes.
people are using it. So there's still opportunities in these markets. And let
Yes.
me make a plug right now that what we found in virtual wellness, and this is something that I really did not expect. When we launched that platform, Trinidadians have this habit of sharing everything they get on their WhatsApp groups, right? And we had patients from outside of Trinidad using this platform.
Wow.
And even with Patient Connect, this is very interesting, and it's a very untapped market. And we definitely need to look at it more. Our diaspora out there, especially in the US, where healthcare costs are so exorbitant, even with insurance, they were using virtual wellness. I mean, it was a
Wow.
free platform, so that's fine. But they even use now Patient Connect, because what it might cost them in US dollars might be 29
Correct.
bucks, as the Americans would say. 29 bucks for a doctor's visit on Patient Connect. In the US, a doctor's visit is not $29.
That's right.
And we found that our diaspora out there, which is huge, I think it's probably the same size as the population in Trinidad, because
Wow.
Trinidadians are everywhere,
Everywhere.
right? Everywhere. Um, and we found patients, Trinidadians, even West Indians, who live outside, and they still want to connect with
Yes.
a local provider, because it's their culture.
It's a
They
culture.
want to deal with a Trinidadian
Yes.
health provider, a doctor or a nurse or a pharmacist or physiotherapist, what have you. And we
Wow.
found that was very interesting that we learned in the virtual wellness experience. And we are now seeing it with Patient Connect. That
Yes.
for Trinidadians who live in abroad, they're using these platforms. And when I ask them sometimes, we try to have a little discussion. Why are you using this? You're in the United States. Come on,
Yeah.
one of the best healthcare systems in the world. And they
On
said
paper.
cost on paper. The cost, even when they have some of the best
Insurance.
insurance plans, they are it's very difficult for them to get it, and they prefer sometimes to speak to their local counterparts. And that's an interesting market.
Amazing. It's an interesting market, but it also serves to remind us, all the listeners, and for all of the people that you're going to share this talk with after, that we have so much good being built and developed here. And sometimes we miss it. People from outside, across the seas, are tapping in to this service. And this is our opportunity to tap into what we have here that is of such great quality. And as Lisa Kalshai, Lisa, thanks for joining in. You made the comment, the one word comment, revolutionary. And this is all because of Dr. Navi and his team that is working assiduously to, create something that is affordable and that is useful for the masses. So I would send you the link after the show on my pages. But there's also a number that I will flash across. So if you want some more information, you can call this number. You'll be assisted by a virtual assistant. I think I have one or two healthcare providers here. So you want to get on board, please call as well. We want a larger cadre of supporters, not only in using, but in directing the medical care of the persons who will be tapping in. And something that's very important, it's so ironic that today, I think today was the opening of the climate change conference. And the use of virtual health is also a means for those of us who are very concerned about climate change, that this is an opportunity to reduce our carbon footprint using this sort of platform. For the doctors, less paper. Listen to me. I cannot get enough drawer space for no patient notes. So having an electronic system that allows you to collate all your information without using paper. For those who you use less gas, less emissions to the environment, because you don't have to come to the doctor's office as often. And you can, because everything is online. So if you're also interested in reducing your carbon footprint, in improving the climate in the short, medium, and long term, this is the way to go. And something that creeps up into my head, and you mentioned it briefly about insurance for those in the US. What has been the appetite of our insurers in Trinidad and Tobago in reimbursing virtual health? Because I know from a physiotherapy aspect, there was a bit of traction from some of our insurance companies in reimbursing these visits. Is there any discussion with the insurers, for example, with regards to that part of it?
Yes, very good question, Stacy. So, in the very early days, we reached out to the major insurance providers, and they are actually all on board. So whenever you have a visit, you can actually claim it as a medical visit. Let me tell you something about the insurance companies, and I've learned this over the years during insurance medicals myself, that the insurance companies, they want to see the bottom line is that they are saving money on their claims.
Yeah.
And when we showed them that a doctor's visit, for example, on Patient Connect is probably $200, and maybe a mental health or a dietitian visit will be one third less as well than an in-person visit, because that's where the savings come in when you do these things via telehealth. And they found that they were seeing the claims coming in for $200 and these smaller amounts, and they were happy to actually come on board. So patients who use it, they can claim back on their insurance as well. So
Excellent.
that's another plus.
Another avenue. So I know that many people, somebody just asked the question about, a lot of their elderly persons are not on Facebook to listen to this. So it's this will be on YouTube. I'm going to post a YouTube link as well that you can send to them via WhatsApp. Listen, my mother is 77 years old and she lives on YouTube and on WhatsApp. So, and many of our elderly persons, sometimes we assume they're not savvy. A lot of them are quite tech savvy and look at platforms we don't expect. So I would send a YouTube link onto my pages. Miss Judy, you asked the question, I'll make sure you get it. And all of our listeners, we encourage you to send the information out as far and as wide. And there's a number up on your screen, 685 HELP. If you have someone who wants to get on board as a provider or as a patient, this is your opportunity. For those of you as well, and Navi, this was supposed to be a 30 to 45 minutes program, and we almost an hour, and I don't want to take you away from all that you have to do. And I have to be so thankful that our listeners have stayed on and they're sharing this like crazy. But for all our business owners, there are a few business owners that I'm seeing online. What is the value of Patient Connect to a business owner?
Stacy, that's an excellent question, and it would definitely be remiss of me to have ended this and not speak about our employee assistance program. So, again, out of the experience of virtual wellness during the pandemic, many of the businesses that we would be doing some sort of business with, even business owners, they were asking how could we get our employees some healthcare. They can't come physically. This was during the height of the pandemic. They can't come physically. Some of the health centers are closed. They can't get access to care. And what we had the idea to do was to create a virtual employee assistance program, a virtual EAP. And when we looked at it, there was nothing like that available anywhere. And
Right.
we launched that program. It was, I think, last year, thanks to the one of the chambers. They invited us to their program, and we discussed it with their clients. And they have all many of them have signed up, their employees, and the virtual EAP works just as what I showed you there. The employee, while they're at work, can book an appointment and have a
Right.
consultation. So you don't necessarily have to leave the office to go and get some counseling, um, or some sort of treatment or some advice from a pharmacist or a nurse or what have you. And the other value of it is that, I mean, you're thinking about not leaving the office. So there's better productivity, no loss of income. You don't have to, as you made the point, you don't have to jump in a car, spend gas money right now that we're trying to really save. Fight up in the traffic with the potholes, go and sit down in an office. Probably, you're not too sure about, still getting COVID, waiting for hours, sometimes to see a provider. You can save all of that time now as an employee and just simply log in and have your consultation. And what we found is that the employers are now willing to pay for that service as part of their EAP.
Yes.
There's no monthly retainer, there's nothing like that.
Right.
They can just simply use the platform as it exists as an employee. Tell your employees, look, sign up for this, and whenever a situation arises, you can do it. We have a client right now in Suriname. It's a Trinidadian company doing some work in Suriname because I do a lot of
Right.
oil and gas work.
Right.
And they have a situation where someone's relative passed away and they were on a rig um, in off Suriname, and
Right.
they needed counseling. So they were able to connect to the
Wow.
platform, and we could have had that session of counseling for them while they are on a platform. They do not
Wow.
have to leave the platform because leaving a platform will cost the company also a lot of money.
That's right.
Plus, they're not going to reach back to Trinidad anytime soon. So they felt that they needed a consultation. So I'm just showing you
Yes.
that the range, the reach
Wow.
of what you can do now with your phone and internet connection,
It's just
once you
amazing.
have the right platform. So a virtual EAP is available, and you can just sign up your employees that you can give them the link, let them sign up on their own when they need
Right.
it. You decide. Different companies have different ways of paying for it. Sometimes the
Yes.
company say they will pay for it. Sometimes they go 50-50. Sometimes they tell the
Right.
employee, look, you will need to pay for this consultation or what have you. But whichever way it is, it's available. The virtual
Yes.
EAP is now available. And this is something that, we're just trying to expand more and more into the oil and gas sector as well. And I have other opportunities with some other companies to talk about it. But it's definitely, something that is on the horizon.
I just wanted to put up this comment from one of our viewers, Lisa Cash, and she says, she foresees a decrease in the mortality rate as a result of having this facility. And I cannot agree more because it bridges so many gaps that currently exist. Whether the gap is location, whether the gap is financial, whether the gap is time, whatever that gap is, this facility, Doc, it has so much, is doing so much, and has so much potential for Trinidad and Tobago and the region. And time is on us. I wish we could stay for the rest of the evening talking about this. Thank you to all the viewers who are staying on, who are participating. But I want to just bring us to a close and to give you an opportunity to give us some final thoughts about this, and how can people contact um, Patient Connect? How can they become a part of? And again, to everybody, when Doc is finished, I will have my final words to remind us of a few things. But I'm passing on the mic to Dr. Muradali.
Yeah, so Stacey, um, digital health is here to stay. And with the emergence of the electronic health records, so you made the point earlier that now is the time that, as a health provider, we need to try and clean up that office of all of that paperwork. And here it is, you have a digital platform where you could have all your patients' notes electronically in a safe and secure environment. So that's definitely one of the important things. The patient now has that record. They're traveling, they want to there's a referral. They always have their patient's notes with them. And it's a very empowering feature of Patient Connect. It actually gives the patients their notes with them that they can go and update regularly. They can review it. That's so important for me because sometimes we have to change that health provider patient dynamic in such a way where it must be give and take. It must be where we consult. It must be where we have that better interaction and more frequent interaction, because that is the only way, as Lisa said, we can reduce mortality is with more patient engagement. So
Yes.
that is where the electronic health records come in. The other aspect of it is having the patient portal with your telemedicine. So you can book your consultations whenever you want to from your home, from whichever space you are, from your work, wherever. Now, recently, we're seeing on rigs and platforms offshore, right? In other countries with the diaspora, wherever you are, you now have access to healthcare. So the issue that people were saying before, they're waiting for the government to provide this, or you're waiting for the government to provide that in the health centers and the clinics and so forth. You have this available to you for a very affordable cost, one third less than inpatient. So that is the value of that. And you can do this after hours, public holidays, weekends. So that's a real convenience for many patients. The other aspect, and this is something that we are now building, and maybe if you give me the opportunity another time when we fully test it, and when you ask for one of those devices. But the next step, the next phase, and this is definitely, we believe, looking at the data across the world, that can help reduce the mortality and morbidity, so the suffering of disease and dying from a disease, is the remote home health monitoring. And
Yes.
that those devices at home that are simple, it's just like the size of your phone. One device can actually take your blood pressure, it can test your sugar, your pulse rate, it can check your temperature, it can do your oxygen saturation, all of these things with one device the size of your phone. Another device that's smaller than your phone can listen to your heart. There's another device, as I said, you could look into your ear. And all of these things are in real time. So once you
Yes.
connect that device to Patient Connect, your provider could see what's going on or listen to the heart sounds or to see your blood pressure, to see your sugar in real time. That is the value of, of what is to come in reducing the suffering, what we call the morbidity, and of course, dying from a disease, the mortality. And I see that especially useful in a country where we have over 200,000 diabetics,
That's right.
where we have so many patients who don't even know they're diabetic.
Yes.
Just today in the newspaper, the principal medical officer of health, Dr. Abdul Richards, made a startling revelation that I think the data from 2021 is that there was 1,600 deaths from diabetes. And
Wow.
that is just from diabetes. You know, there people die from heart attacks related to diabetes, but it may be recorded as a heart disease. And about 2,000 people die every year in this country from heart disease.
Wow.
When you add the total of heart disease, the strokes, diabetes, all things that if there was proper monitoring, when you add that up, we are over 5,000. That is 10 times
Yes.
the death rate from crime, right?
Wow.
And so we say crime is so important. And yes, nobody is disputing that, you know, we want to be safe, we want to be, to feel safe in our homes.
Yes.
But 10 times more people die from lifestyle diseases.
Wow.
And that's a small number. I'm just giving you, you know, data that just from strokes and heart disease and
Yes.
diabetes, we haven't added asthma, we haven't added cancer. So we've not
Cancer.
added cancer to that number. So it is more, so many more people die from lack of testing, lack of monitoring,
Yes.
poor compliance, all of which can now assist you if using digital health. Because
Yes.
what we do with our clients, for example, we call our clients once a month to find out how things are going with them. A cold call, you actually, not a robot voice or not an email, a real call to find out how are things. We are not necessarily a doctor, but our virtual assistant will contact
Yes.
them. And if they say, well, they're not going too well, we say, okay, well, let's help. We will book an appointment for you
Yes.
to get your doctor. Now think about that, having that service readily available to you at very, very affordable prices.
Correct.
And in the comfort of your own home, where you're
Your own
saving
home.
your gas money and you're saving sitting down in a room waiting for hours, you know. So that is the value that is
Yes.
offered now. And everything I've told you is available. It's
Yes.
just we are now trying to, you know, do the testing, and we are actually trying to expand into other countries, as I mentioned, into Latin America and up the Caribbean. So we have a lot going on, but we definitely, at the end of the day, this is the take home. The take home is that we want to be able to connect health providers with patients using digital technologies. Everyone has a phone and
That's right.
everyone has internet.
That's
Once
right.
you have that and you can use WhatsApp or email, you can use Patient Connect. It is that
Yes.
simple.
Thank you so very much. You said everything that has needed to be said. And ladies and gentlemen, thank you so much for tuning in. Dr. Muradali, I know you're busy and you will be back on this show. Thank you for letting me know that you have no problem coming back on. This has been such an eye-opener for the listeners, an eye-opener for me. And this is something that we need to get on board. And looking at that revelation, with regards to the death rate because of lifestyle diseases, many diseases that have modifiable changes that we can help manage better using a platform as this, taking into context what one of our viewers said with regards to the decreasing the mortality rate. With just these simple tools, we need to get on board, not as a substitute for face-to-face care, but as a complementary avenue, as an adjunct
Yeah.
to affordable care. Thank you so very, very, very much for coming on. Please hold on. I'm taking you off just for a minute, but don't go anywhere. Let me just have a small chat with the viewers. Everybody, thank you so much for staying on. The show has gone on for longer than I anticipated, and you stayed because of the value and the interest that has been generated. And I will be having Dr. Muradali back with us to speak more about digital healthcare and other aspects to it, and especially that remote monitoring when it comes into play, because this is such an important area. It is vital for us to have better health. It is not just about us waking up in the morning. I saw TikTok a few days ago that said, I'm eating well, I'm exercising, I'm drinking water, I'm still going to die. We are going to die. That's our eventuality. But the question is, what quality of life do you want to have while you are still alive? What type of death do we want to have? Yes, we're going to go down in the grave, but the question is how. And so we need to use these avenues as far as possible to ensure that we maintain and improve our health. So I thank you all so very much for staying on. I thank you so much for all of you who have shared the live. Feel free to share it after. Stay close to my Facebook, Instagram pages, my YouTube channel, so that I would send little tidbits more about digital healthcare over the upcoming weeks. I will also send the link for those of you who want to sign up this week to Patients Connect. And I am again eternally grateful for the expertise that we have here right in Trinidad. Dr. Muradali is an example of that, and he has used his knowledge of economy, he has used his knowledge of dentistry, medicine, of public health to create something not to lift himself, but to elevate the health and wellness of our communities. And persons like these must be commended, and I commend him immensely for all the work that he is doing and that he continues to do. So thank you all again so very much for joining in. If you have any further comments, any questions, just send it at the end of the live. I will see it. Thank you for those who commented, those who send me private messages. And very soon we will have another session, another expert, another local, sharing more information to improve our health and our wellness right here on Real Time with Dr. Stacy. So stay well, everybody, and we'll be back with you just in a couple of weeks. So just stay tuned and take care.